I was the chairman of the Ohio Commission on Minority Health for many years. I first got appointed just around 2001 or 2002. And then when the founding chair sort of retired, I became the chair. And I had to give every 2 month chairman's report. And so basically we put together a little PowerPoint on a different aspect of health disparities. And so, and again, learned while I was doing it, learned a lot, while I was doing this research. What does the research show? Because I'm tend to, we were like, what does the data show? Not what you feel, but what does the data show? And so I would give like a 20, 25-minute talk each time. And then once I would do that, I would kind of compose a little article that I put on my website, hypertension differences, cholesterol differences, sleep differences, and because I have a 90% African-American population, it was mostly African-American things. And again, when I was appointed to the Commission on Minority Health, I thought minorities had bad outcomes and then the majority had good outcomes. But that's not exactly true. Asian American, their life expectancy is like 87 years old. Hispanic Latinos, life expectancy 82. European Americans, white Americans, 78, right? African Americans, 74. So I was surprised. And when I, talk to residents and whatnot, they're always surprised because they think minority. So when I was trying to give a balanced sort of minority report as his chairman, I'm like, wow, all this bad stuff associated with being African Americans and not so much impacting the lifespan, at least in Asian Americans and Hispanic Latinos. And so I said, I was going to try to write a book just on all these little pearls that I learned about African Americans in terms of what tend to see more of this, and you tend to see less of that. Just like when we learned in medical school, we learned about Ashkenazi Jews, right? And they say Ashkenazi Jews increased risk for breast cancer, increased risk for colon cancer, and some birth defects, right? And we learned that, and that was appropriate. 3 years ago, I had a patient, Ashkenazi Jew. She said, I said, well, I've been waiting for you my whole practice, right? My whole life. And we did a mammogram and a colonoscopy, and it was normal. But so the same thing is true if you have an African-American patient. What cancers do you tend to see? What things don't you see? What sort of leans more this way and that way, just to help you in your clinical care. And so the important thing is, humans are 99.9% the same genetically, right? So it's not, what is all this? But that 0.1% makes all the difference, right? That's what gives African Americans an increased risk for prostate cancer, colon cancer, aggressive breast cancer, all the different things, the increased lung cancer with less smoking. Like African Americans tend to smoke less, but that little less smoking turns out to be much more lung cancer, right? And so the book was just a way of, if you have a provider who sees a large number of African Americans and they want to give best practice and try to help them out, right, with repeating labs and things like I mentioned earlier, benign ethnic neutropenia, slightly off TSH, those little lab differences, it just sort of explains it, and it points to the research that explains it as well. And so it was just a pro. And I was rejected a couple times, and they said, well, write a book about, all minorities. I was like, well, I don't know anything about Hispanic Latino health. I don't know anything about, Asian health. I don't have that many patients, and I haven't done that much reading. And African Americans have the worst outcomes. They deserve their own book. We have to keep talking about health disparities, and I'm not a good complainer, but let's do something about it. Let's see I can't make the world a better place, but I can certainly give better care and improve my care for my African American patients. So that was the drive.